In vitro fertilization or IVF in particular is an assisted procreation technique which consists of carry-out fertilization, that is to say a meeting of the sperm and the egg in the laboratory, outside the woman's body, re-implantation of the embryo into the uterus of the future mother. The different stages of in vitro fertilization, IVF, first step. Stimulation. The objective of stimulation, a hormonal treatment administered by injection, is on the one hand to obtain the simultaneous development of several follicles and on the other hand to be able to collect oocytes before ovulation. This treatment is monitored appropriately by ultrasound scans and hormonal measurements. When the follicles are mature, the triggering of ovulation is prescribed at a precise time, which also determines the time of the follicular puncture. 2 Étape. La ponction folliculaire. Le recueil des ovocytes. Ponction folliculaire, est réalisée sous anesthésie générale et dure une vingtaine de minutes. Le spécialiste ponctionne les follicules à l'aide d'une aiguille à travers les parois du vagin et recueille les ovocytes par aspiration du liquide folliculaire, le tout, sous contrôle échographique. L'intervention est suivie de quelques heures de repos dans notre hôpital de jour. Third step. Fertilization stage of reproduction corresponding to the penetration of a sperm inside an oocyte and which will unite to form an embryo. The prepared spermatozoa are simply placed in contact with the oocytes in a culture dish containing a liquid nutrient medium and placed in an incubator at 37 degrees Celsius. The motile spermatozoa come spontaneously, without external help, into contact with the oocyte. A single spermatozoan will fertilize this one. Fourth stage. Embryonic development. The day after the puncture, the fertilized oocytes, or zygotes, are identifiable by the presence of two nuclei, called pronuclei. One comes from the oocyte and the other from the sperm. Not all eggs are necessarily fertilized. Zygotes become 2 to 4 cell embryos within 24 hours, then 6 to 8 cells 24 hours later. In the majority of cases, the embryos are transferred 2 to 3 days after the puncture. Fifth step. Embryo transfer. Embryo transfer is a simple and painless procedure which is sometimes carried out under ultrasound control. It is carried out using a thin and flexible catheter inserted vaginally into the uterus with the patient lying in the gynecological position. The embryo is deposited inside the uterus and develops there until its establishment.